We have 2,000 academics, researchers, clinicians and support staff who have a single goal, which is to improve human health, to improve access and equity, and to use evidence and research to discover and translate findings that are really going to improve the health of babies, children, adolescents, right into old age. We are embedded in our health services because it's only through partnership that we can make these changes that make a difference. We are also embedded in community. Many of our large-scale clinical trials are community-based clinical trials. It's when researchers get together in partnership with clinicians and health services, departments, community practices that we can recognise what the critical questions are, develop evidence and then change practice. You can't do research unless you have cutting-edge technology to support the research. We have infrastructure that supports the clinical trials, which include biostatistics support, clinical trial design support, and also there's massive amounts of data that's collected. There's all sorts of AI techniques to actually interrogate the data. It'll include aspects such as biobanking. Prevention is one of our major focuses. We have the STAR-E clinical trial and the ESPRIT clinical trial, which have looked at over 20,000 Australians over the age of 70, and they've got interventions such as taking an aspirin or taking a lipid-lowering agent. Does that make individuals less prone to heart attacks? Are they less prone to stroke? So we are asking big prevention questions. A lot of the work in our School of Public Health is based on what's known as registries. Registries is where we collect data for certain disease types and we look across a whole population from diagnosis to treatment to outcomes. You recognise things that are going on in the communities of practice that you can't see from looking at an individual patient. With the onset of COVID, the development of mRNA vaccines meant there was enormous international interest in the actual biology of mRNA and how you could target that to make a vaccine. And also to look at mRNA biology in the context of cancer and other diseases. So we're very excited that Moderna is building their Moderna manufacturing plant across the road from the campus. They are going to have a training centre for a new workforce, which is funded by the State Government of Victoria. And we're going to be working with their scientists in terms of building a pipeline of therapeutics and biological understanding of mRNA and how it can be applied for industry. At Monash University, we don't just teach medicine, we teach nursing and allied health, which includes physiotherapy, occupational therapy, social work and paramedics. We also have a very outstanding psychology school and we teach biomedical science. Having that breadth and depth of not only medicine but also the health-related sciences means our students train and learn together and they have a very good idea of how they can work together as a team. In nursing, we run a number of master's programs in trauma, emergency care, intensive care, which is upskilling existing workforce so they can fulfil those roles in our major public hospitals. And also we run a number of other programs in mental health, in wound care, in aged care, recognising that we need to constantly provide a skilled workforce to meet the demand in the community.